Well, we've just attended the State Department meeting whereby they've invited stakeholders, professionals and consumers to help them make a decision on the position they're going to take at the upcoming international treaty negotiations on mercury products, and dental amalgam is one of those products that is included. I attended as an injured consumer, as I was seriously injured by mercury fillings in 1998. I had an old filling taken out and a new one placed, and 7 days later I was struck with double vision and diagnosed with multiple sclerosis, lupus, and myasthenia gravis. I'm grateful that the State Department invited us to have an input as a consumer stakeholder at these meetings, but frankly, I don't think anything's going to happen in the very near future at all, and I'm concerned about that. How many more millions have to be poisoned from mercury fillings? I think it's really important for the consumer to be heard at these meetings. The issue of mercury poisoning and the problems with the environment is extremely important. But there's a link between the environment and health, and the State Department even acknowledged that. So it was important that I was there to represent consumers, and that Karen Burns and Karen Palmer were there to represent occupational exposure as dental personnel. The State Department needs to hear from us. Our faces and our voices must be heard. Bottom line, we need to make a switch today, not tomorrow, not 10 years from now, and that's what I told the State Department. I encourage every individual from countries around the world to get involved, to speak out, to take a position, to let their governments know, to bring public awareness about the dangers of mercury fillings. That's a silver-colored filling that contains 50% mercury. Get involved, speak out, and tell them to make a switch now.